Hello, great nurses. Welcome to the Nursing Career Pathway channel, where we guide nurses on their pathway to success. This is your career coach. In NES 111 Applied Chemistry, Module 5, we understood the application of knowledge of carbon and hydrocarbons and their components with regards to nursing practice. Here in Module 6, we want to know the classification and structure of organic and inorganic compounds and their impact on nursing science. As we all know, here are the circles to success. Key to note, red circles indicate that these areas are a must-know for your next examination. Orange circles indicate that these areas are good for clinicals, and green circles ask you to skim through this preview at later times. Here are the specific objectives we will achieve for Module 6. 1. Organic and inorganic compounds. 2. Understand some examples of oxidation products of alcohol. We understand the examples and uses of aldehydes in nursing practice. We talk about chemical compounds of carbohydrates, protein, fatty acid, and lipids. We will discuss the biological importance of some organic and inorganic substances. We will draw some biochemical structures of organic and inorganic compounds and their examples. Let's begin with Objective 1. Objective 1 says organic and inorganic compounds. Take note of the acronym OIL. Organic compounds are found inside lipids. They are fat soluble. Inorganic compounds are found in liquids. They are water soluble. What are organic compounds? Organic compounds are compounds that contain carbon atoms, typically bonded to hydrogen, oxygen, nitrogen, or sulfur. Examples include carbohydrates, proteins, lipids, and nucleic acid. Inorganic compounds. These are compounds that do not primarily contain carbon. They include water, salt, acids, and bases. Nursing application. Organic compounds like carbohydrates and protein are crucial for energy production and tissue repair, while inorganic compounds like water and salts play an essential role in maintaining body function. Example, hydration and electrolyte balance. Let's look at a way of summarizing everything we talked about so far. We want to look at the properties, we want to look at the organic compound, the inorganic compound, and then the nursing action. First, with regards to definition, organic compounds are compounds that contain carbon to hydrogen bond. Example is your drug glucose. Inorganic compounds are compounds that do not contain carbon to hydrogen bonds. Example is your salt, acid, and gases. They are inorganic. How does this apply to nursing practice? With regards to organic or inorganic compounds, the nurse must check IV labels. Dextrose is organic. It will increase energy or calories versus sodium chloride, which is inorganic in our normal saline, and it will help in regulating electrolyte and hydration purposes. Based on solubility, we want to look at organic and inorganic compounds. Based on solubility, organic compounds are often fat soluble. Example is your diazepam. Inorganic compounds are usually water soluble. Example is your potassium chloride. This is a nursing action with regards to solubility of organic or inorganic compounds. Nurses must assess fat soluble drug because they accumulate in obesity. So there is need for those adjustments. Fat soluble medications must be checked with regards to obese patients in order for us to adjust the dosage. Next is stability. With regards to organic and inorganic compounds, we want to compare their stability. Organic compounds can degrade. Example is your total parenteral nutrient. It is usually lipid oxidized, so it must be checked. For inorganic compounds, they are usually very stable. Example is your saline bag. The normal saline is very stable compared to TPN, which is very unstable. Nursing action with regards to stability of inorganic and organic compounds, nurses must discard cloudy TPN because rancid fats can cause septic risk. The next property we want to look at with regards to organic and inorganic compound is toxicity. With regards to toxicity, organic compounds produce metabolites which may be very toxic. Example is methanol and formic acid. With regards to metabolites of methanol leading to formic acid, one of the things we want to take note is the function of the liver. The liver, as you can see, play a lot of roles with regards to metabolism. So, organic compounds such as methanol in themselves may not be harmful, but when they metabolize in the liver by the enzymes alcohol dehydrogenase, it forms formaldehyde and formic acid, leading to metabolic acidosis. So the metabolites of methanol are dangerous and they could lead to acidosis. For inorganic compounds, they have direct toxicity. Example, cyanide. While methanol may not be harmful or toxic in itself except it has been metabolized, inorganic compounds such as cyanide are directly toxic. Nursing action. Nurses must, with regards to toxicity, must check methanol poisoning. Give fomepizole. Fomepizole is an antidote of methanol poisoning and it will block the toxic metabolite formation. Objective 2. Examples of oxidation products of alcohol. Methanol or ethylene glycol poisoning is a medical emergency common in suicide attempts or accidental ingestion. We want to look at the oxidation product of alcohol and their implication to nurses. Alcohol oxidation typically results in the formation of aldehydes and carboxylic acid. More examples will be given in classroom situation. However, let's understand that the oxidation of alcohol is what gives rise to aldehydes. Example 1. Ethanol, the type of alcohol found in beverages, is oxidized to acetaldehyde and further to acetic acid, which is found in vinegar. Example 2. Methanol is oxidized to formaldehyde, which is toxic and can cause severe damage to the body. Take note of the oxidation products of ethanol and methanol. These are areas for your next examination. Nursing application. Oxidation products of alcohol such as acetaldehyde can cause toxicity in patients with excessive alcohol consumption. Understanding this process is key when managing patients with alcohol poisoning or metabolic disorders. Let's look at alcohol, oxidation product, nursing crisis and action as a form of summary to what we just said. Methanol. Oxidation product of methanol is formaldehyde, which is further oxidized to formic acid, which is toxic. Nursing crisis. It could lead to metabolic acidosis and blindness. Action. Give fomepizole. This blocks alcohol dehydrogenase or carry out hemodialysis. Ethylene glycol is an alcohol. You can see the oxidation product of ethylene glycol is glycolic acid, which will further oxidize to oxalic acid. Nursing action. Hypocalcemia and renal failure, leading to formation of crystals in urine. Methanol or ethylene glycol are not harmful in themselves, but their metabolites are harmful to the body. What is the nursing action to be carried out with regards to ethylene glycol? Calcium glyconate is given for tetanus as oxalic acid binds to calcium to form calcium oxalate. Usually, when oxalic acid is formed, it will bind to calcium. As it binds to calcium, more calcium in the body will be bind to oxalic acid, leading to tetany. So it is very important for the nurse to administer calcium gluconate, thiamine or pyridoxine to shunt metabolism. Thiamine or pyridoxine, they are vitamins that act as cofactors, helping the body to metabolize ethylene glycol into less toxic substances. So thiamine, pyridoxine, these are vitamins that help with the harm caused by ethylene glycol in reduction of calcium. What does this shunt mean? Shunt means that phenothiamine and pyridosine direct ethylene glycol away from the toxic pathway, breaking down and making it safer. Objective number 3. Examples and uses of aldehydes in nursing practice. We want to learn the application of aldehyde, particularly in medical field. The first example is formaldehyde. An example of aldehyde, formaldehyde. Formaldehyde is used as a disinfectant and preservative in the hospital. It's also used in embalming to preserve biological tissues. The next one is acetaldehyde. It's a byproduct of alcohol metabolism but also used in the production of synthetic chemicals and medicines. What is the nursing application of aldehyde? Aldehydes like formaldehyde are used in sterilization equipment and preserving medical samples. So they are used in sterilizing medical equipment. Nurses must also recognize the toxic effect of aldehydes in patients who may be exposed to them during treatment or medical procedures. As a form of summary, let's look at formaldehyde and glutaraldehyde as examples of aldehyde, how they are used in nursing crises, and actions that nurses must take with regards to the crisis involved. Number 1, formaldehyde. How is it applied to nursing? It involves in tissue preservation. Example in pathology, formaldehyde is necessary for tissue preservation. Nursing crisis. It is carcinogenic and it could lead to nasal or throat cancer. So there is need for the nurse to wear PPE such as N95 mask in the lab and report any form of formaldehyde fumes. Second is glutaraldehyde. How is it used in nursing? Second is glutaraldehyde. How is it used in nursing? It's used in cold sterilization of endoscopes. Nursing crisis. Glutaraldehyde has potential of causing asthma and skin burns from the vapor. Nursing action. Use inverted cabinets. Check expiration. It is usually ineffective after 14 days. So before applying glutaraldehyde in cold sterilization of endoscope, you must ensure to check expiry date of the glutaraldehyde you are about to use. You must ensure to check the expiry date. These are some tips. Aldehyde sterilize equipment but cause occupational asthma and tissue damage. A nurse develops wheezing after cleaning endoscopes. Glutaraldehyde induced asthma, caused it. Action. Report to Occupational Safety and Health Administration (OSHA). Switch to acetaldehyde for less toxicity. So the facility should replace glutaraldehyde with a less harmful aldehyde such as acetaldehyde, which is less toxic. Objective number 6. Chemical compounds of carbohydrates, protein, fatty acids, and lipids. So we want to understand the chemical composition of essential biomolecules. Chemical compounds of carbohydrates, protein, fatty acids, and lipids. Carbohydrates. Carbohydrates are organic compounds made of carbon, hydrogen, and oxygen. The simplest form of glucose, C6H12O6, a primary energy source for the body. Proteins. Proteins are composed of amino acids linked by peptide bonds. The structure includes a central carbon atom bonded to a hydrogen atom, an amino group, a carboxyl group, and a side chain. So basically, proteins are made up of amino acid, which is the amino group NH2, carboxyl group COOH, and a side chain. Fatty acid. Fatty acids are long hydrocarbon chains with a carboxyl group at one end. They are key components of lipids. So fatty acids are key components of lipids. Lipids. Lipids are a diverse group of compounds including fats, oils, and cholesterol. Lipids store energy and form cell membrane. Nursing application of carbohydrates, protein, fatty acids, and lipids. For carbohydrates, carbohydrates are essential for energy, especially for patients recovering from surgery or trauma. Proteins are crucial for tissue repair and immune function. It's important in wound healing. Fatty acids and lipids are necessary for cell membrane structure, hormone production, which are critical for hormone regulation and metabolism in patients. At the form of summary, we look at the compounds we just talked about, their key structure, nursing application, and then nursing action. Number one, carbohydrates. Carbohydrates, the major structure of carbohydrates is glucose. Glucose is a ring form organic compound made up of C6, H12, and O6. 6 molecules of carbon, 12 molecules of hydrogen, and 6 molecules of oxygen. How does it apply to nursing? With regards to carbohydrate, nurses must monitor blood sugar, hypoglycemia, and they must also monitor for hyperglycemia. Action. With regards to carbohydrates, dextrose IV is usually given when a patient's blood glucose, especially random blood sugar, is less than 70 mg per dl. So there is need to check for insulin errors. Protein. Protein has its major structure as amino acids NH2, CHRO, COOH. Nursing application of protein is in albumin. When albumin doesn't work properly in the body, it leads to edema, and therefore there is need for edema assessment. When albumin level drops, usually in malnutrition or when there is a liver or kidney disease, the blood cannot hold onto water effectively. So fluid will leak into tissues, causing edema, especially in the legs and the eyes. So albumin in edema assessment means that there is need to check albumin level. It is the reason why there is a swell on the patient's extremities. Because low albumin, there is need to check for malnutrition, ascites, or sepsis. Fatty acids. Fatty acid, the key structure of fatty acid is long hydrocarbon chain plus the ethanoic acid group. How is it applied to nursing? Fatty acid is applied in regards to TPN, total has a calorie source. Action for nurses. With regards to TPN and fatty acid, it is recommended that nurses discard any cloudy TPN. If not, you risk sepsis. The next compound is lipids. The key structure for lipids are triglyceride. 3 fatty acids plus glycerol gives us the lipids. Nursing application. It is applied with regards to cholesterol plaques. Cholesterol plaques can cause cardiovascular disease risk. Cholesterol plaques are fatty acids that have deposited and built on the walls of the arteries over time. The plaques will narrow and harden the arteries, a process called atherosclerosis. Cardiovascular diseases include heart attacks, strokes, and hypertension. High LDL, which is bad. When there is high LDL, there is need to reinforce statin adherence and low-fat diet. LDL is bad cholesterol for short, low-density lipoprotein. It has to do with cholesterol. With regards to lipids, when LDL, which is supposed to be low, is now high, there is need for us to reinforce statin adherence and low-fat diet. LDL usually is bad cholesterol, increased risk of heart disease and even stroke, because this LDL contributes to plaques buildup in the arteries, just like we have seen. Statin will help to lower the LDL levels and reduce saturated and trans fats. Reducing saturated and trans fat means you should advise the patient to stop eating fried foods, fatty meats, butter, etc. They should eat more of fruits, vegetables, and whole grain. Objective 5. Biological importance of some organic and inorganic substances. This is to help us recognize the biological rules of organic and inorganic substances. We've discussed some inorganic and organic compounds. We want to know how they now relate to nursing. Organic substances. Organic substances play key roles in metabolism. Examples of these organic substances are carbs, protein, and lipids. They also help in energy production and cellular function. Inorganic substances. Inorganic substances such as water, electrolytes, and oxygen. Water is vital for hydration, nutrient transport, and temperature regulation. Electrolytes such as potassium ion, calcium ion, and the chloride ion are essential for nerve function, muscle contraction, and maintaining of fluid balance. Oxygen, on the other hand, is an inorganic substance. It is required for cellular respiration and energy production. Nursing application. Nurses must understand the role of these substances in maintaining homeostasis. Homeostasis is simply the balance of the internal environment of an organism. There is need to monitor fluid balance, electrolytes, and oxygen levels as it is fundamental in patient care. Low magnesium chloride. When magnesium chloride is low, there is need to note that hypocalcemia will not fix until magnesium is replaced. There is need to always check for magnesium in arrhythmia patients. So when a patient has low magnesium, it can block the body's ability to correct low calcium, which leads to hypocalcemia. Even if calcium supplements are given, it will not work because magnesium is needed for the release of the action of the parathyroid hormone, PTH, which regulates calcium levels in the blood. So if magnesium is low, parathyroid does not work. So even if you give calcium supplements, there will be no improvement in calcium levels. So as a form of summary for what we have talked about with regards to organic compounds, inorganic compounds, let's look at the substances, their biological role, nursing crisis, and then the action nurses should take. Glucose is an organic substance. It's responsible for energy for brains or cells. Nursing crisis. Hypoglycemia could result, leading to neural changes. What should the nurse do? Give at least 15 grams fast carbs, 4 ounces of orange juice. Then recheck the glucose in 15 minutes. 15 gram fast carb is a fast-acting carbohydrate. 4 ounces is equal to half cup of orange juice. 4 ounce orange juice, it simply means give half cup of orange juice. Repeat this after 15 minutes. If it is still low, use the 15 to 15 rule to apply another dose of half cup of orange juice. This is a direct way of treating hypoglycemia. Organic substances. Hemoglobin. Hemoglobin carries oxygen. It has iron present. Nursing crisis. Hemoglobin loss can cause anemia, leading to pallor or fatigue. Action. The nurse must monitor hemoglobin and hematocrit count. There is need to assess for bleeding. There is need for iron supplements. With regards to bleeding, there could be internal bleeding or external bleeding. Internal bleeding is evidenced by distended abdomen, tachycardia, and even low blood pressure. So there is need to give iron supplement. The next one is inorganic, calcium ion. What is the biological role? It is responsible for muscle contraction and clotting. Nursing crisis. Hypocalcemia could result, evidenced by stick sign and seizures. Nursing action. Nurses should give IV calcium gluconate and check magnesium levels. For inorganic, sodium is responsible in biological role for fluid balance and nerve impulses, nursing crisis. There could be hyponatremia. Hyponatremia can lead to confusion and seizures. What should the nurse do? Nurses must give slow hypertonic saline and also restrict fluids. There is need to restrict further fluid intake as this could lead to more dilution of sodium. So sodium, which is an inorganic compound, is a key extracellular electrolyte that helps control water balance. So if there is hyponatremia, there is need to give slow hypertonic solution such as your 3% or 5% normal saline, which is hypertonic in critical conditions. It is usually given slowly. It should not be rushed, else it will lead to brain damage or osmotic demyelination syndrome. Why should we restrict fluid? Fluid should be restricted because it could lead to hyponatremia. Hyponatremia happens because too much water has dilute sodium. In this case, nurse will restrict the fluid intake to prevent further dilution and help sodium to normalize. Objective number 6. We want to look at some diagrams of some biological structures of organic and inorganic compounds and then their examples. Forget complex diagrams. Nurses need to recognize functional groups that impact care. These are basic functional groups that impact care. It's not about drawing of diagrams. It's about knowing what those diagrams have to apply in nursing practice. So we'll look at some biological structures of organic and inorganic compounds and their examples. Organic compounds are molecules that contain carbon atoms bonded to hydrogen atoms, like we see carbon to hydrogen bonds, and often also oxygen, nitrogen, sulfur, or phosphorus. The first one is carbohydrates. It's a simple sugar like glucose. They are rings that are made of carbon, hydrogen, and oxygen. The structure can be drawn as a hexagon with oxygen and hydrogen groups attached. We can see the diagram of glucose molecule shaped like a hexagon. You can see the shape, you can see the diagram. You can practice it in case you are asked to draw. Most likely, you may not be asked. The next one is the amino acid. Amino acid depicts the basic structure with a central carbon, an amino group, a carboxyl group, and a variable arrow group. The arrow group is the alkyl group. The alkyl group is a side chain attached to an amino group, attached to a central carbon, attached to a carboxylic group. So basically, take note of the amino acid structure. Fatty acid, we draw the long hydrocarbon chain with a carboxyl group at one end. So it's also, you can see the shape with the COOH group at one end. Continuously, we'll also discuss some inorganic structures. Example is water. Water is drawn as a bent structure with oxygen in the center and hydrogen atoms on either side. As you can see, the angle between each hydrogen is 104.5 degrees, and we can see that it is polar, having a negative and a positive sign for oxygen and hydrogen respectively. The next one is your sodium chloride. Sodium chloride in a simple form is like a crystalloid. You can see it's a crystal shape. Simple ionic bond between sodium ion and chloride ion. It makes it stable and having a structure of a crystal. Nursing application. Being able to identify this structure helps nurses to understand the underlying biochemical processes that influence drug action, nutrition, and patient's metabolism. Activity. This is a diagram of acetone. Alkyl group with a central carbon leading to double bonded to oxygen is acetone. You can see the structure of dopamine, and you can see the structure of aspirin. Given the structures of the above medications, acetone, dopamine, and aspirin, which of these can cause acidosis? B. Which of these crosses the blood-brain barrier? Number C. Which of these indicates diabetic ketoacidosis? I want you to answer this question in the comment section. Nursing chemistry is not about drawing benzene ring. It's about knowing why you shed potassium before giving insulin in diabetic ketoacidosis. That's the difference between a good nurse and a great one. Activity. This is relevant for your practical. A diabetic patient presents with fruity breath, pulmonary respiration, and glucose 500 mg per dl. Identify what is causing the fruity breath. What is causing pulmonary respiration? C. State the nursing interventions and need for potassium replacement. Hint: inorganic imbalance, potassium ion loss from osmotic diuresis. Hint number 2, nursing actions, IV insulin plus potassium ion replacement. Hint for number 3, fruity breath caused by acetone leading to DKA. Without potassium replacement, insulin will cause lethal hypokalemia. As I round off, these are the circles to success. This video is very relevant for your clinicals. Green circle, you must go over this video again. Next, ensure to practice past questions for your next examination. I want to thank you for staying this far on this video. Kindly subscribe to this channel, hit the notification bell, let us know how you feel about our videos. Till we meet again, it's goodbye from me.